Hi, I'm Dr. Julie Steinauer. Let's talk about exotropia. What the heck is that? Well, it's a form of strabismus or eye turn in which the eye turns out and it can look like it's wandering off, or it can cause a person to look spacey-eyed or disconnected, or like, where are they looking? They're staring back behind you. Now, there's a lot of details about exotropia, but I want to kind of cut it down and make it a little bit more simple. You can have a constant eye turn out. You can have one that is intermittently turning out, or you can also have one that's called alternating, where one eye turns out and then the other eye switches and turns out. Kind of like this. So these are three different ways that you can see exotropia be exhibited. You can also see, combined with exotropia at times, maybe an upward eye turn. Now if you see an out and an upward eye turn, you may notice that the person can tilt their head at times too. So especially if they're trying to pay attention to details or listen really well, they may tend to concentrate and tilt their head to the side in order to try and line things up vertically, maybe even a little bit of a twist of a tilt, but that gets complicated, and there might be other things going on there too. So now again, you can get like a constant eye turn, you can get an intermittent one that happens sometimes, or you can get an alternating one. Exotropia is also associated with a condition oftentimes called convergence insufficiency, where the person has difficulty because the eyes tend to turn out. They have trouble crossing their eyes and lining their eyes up for near work and concentrated near tasks. So whether they're reading, writing, doing schoolwork, maybe working on a computer. Well, what happens if you have this situation where you're looking at a computer or a phone or a book, and all of a sudden the eye just gets tired and it decides to turn out? You might actually see double in the very beginning. So the print may kind of tend to go like this and wiggle as the eye kind of wobbles back and forth, maybe trying to maintain alignment. So that print may go like this. When that happens, eventually the brain gets tired trying to control this process of aligning the two eyes. The image splits off, the eye turns out, and most of the time the brain will ignore that eye that's not in the right location. If it's not lined up and it's staring off at the wall, the brain will kind of tend to shut down that image so that double vision isn't being seen. Otherwise, it'd be really, really distracting. But a person could technically see double right as it's starting to happen. Now, some people will only experience what we call blur, or like moving kind of a target. Like I mentioned, it will look like this, and all of a sudden things will kind of get smeary and blurry, and then whoop, and then all of a sudden it's different. Now that smeary, blurry thing that happens also can be the beginning of double vision, but some people don't recognize it as double. They're not aware enough of their vision to actually see the double, but they do see blur. So any number of those things can exist for the person who has exotropia. Now it can be hard for them to sit still, pay attention to details, or stay focused. So along with convergence insufficiency, this is kind of one of the biggest reasons why people get diagnosed, maybe wrongly, with ADHD. If they have difficulty maintaining eye alignment for near work and they have this convergence problem, again, maybe associated with an exotropia, then they might look like they have problems sitting still and focusing in the classroom. Might even be suggested they have ADHD. So there's lots to dig into on this. I could tell you so much more. But what you're really wanting to know is this treatable? And the answer is yes, it is. Now, there's options in treatment too, but we like functional treatments that aren't invasive and don't require surgery. And so we train the brain how to align and use the two eyes together. Now, just to show you, I have a bunch of glasses sitting here on my desk, but these are specialized glasses, and they're called photosyntonics, or sometimes just called Syntonics light therapy goggles. They look like this. They don't look like anything fancy, but there's different colors to these filters, and when they put the goggles on and they look through the filter at a light, an individual with exotropia can get a signal from the brain to the muscle of the eye, telling the muscle how to pull in and align properly so the eye can get an aligned, straight appearance. Now, it doesn't just take Syntonics alone in order to treat exotropia. There are other things that we do, and you want to think about this a little bit like physical therapy and occupational therapy for the brain and eyes, because vision therapy which is what it's called, is really training the brain to align and use the two eyes together as a unit so that this eye doesn't wander off, intermittently, constantly, or alternating. So we train the brain to align and use the two eyes together. Now, what if you've had surgery for exotropia and you still have this happening? Well, we see this a lot. And so even post-surgery, we can still train the brain to align and use the two eyes together. Now, believe me, it does get tricky the more surgeries you've had, but we have worked with individuals who had as many as 4 and 5 surgeries, and we've still been able to help train the brain to align and use the two eyes together. Realize again, it does get tricky, and it may not mean that we can fully correct everything, but we can make it better depending on your circumstances. So there's really not a situation in which you shouldn't give us a call. So if you're local, contact us at 618-288-1489 to find out if we are able to do something to help you with your exotropia. Or if you're not local to us, maybe you're on the other end of the world, maybe you're in Australia or Japan and you want to connect with us. Well, then go to our website and fill out the questionnaire on our website. That kicks over to us, and then we can connect with you to talk about how we might be able to help you. And if you like this information and you've not done it already, then like our video and subscribe to this YouTube channel so that you can get more of our awesome videos talking about all kinds of vision things that we can help you out with. Thank you.